I am Dr. Harry Chaliki from Mayo Clinic in Arizona. Today, the topic of my presentation is low gradient, low flow severe aortic stenosis diagnosis and management. And this is a concept more recently introduced by Dr. Hachicha in 2007 Circulation article. This is the clinical conundrum that we encounter when patients with severe aortic stenosis, despite preserved ejection fraction, have a low gradient and yet low valve area less than 1 centimeter square typically, and mean gradient less than 40 millimeters of mercury. What to do with these patients and why this scenario occurs. In some cases, this is because of low flow, defined as stroke volume less than 35 mLs per meter square. And the idea is that when left ventricular hypertrophy is in some patients, despite preserved ejection fraction, their stroke volume gets lower because of concentric hypertrophy. And frequently these are elderly women with hypertension. They may have diastolic dysfunction, pulmonary hypertension. And once we find this entity, how do we know how they do? In long term, it has been shown that their prognosis is worse, again by Dr. Hachicha, compared to patients with normal flow and high gradient aortic stenosis. Although there was some controversy whether this is just moderate aortic stenosis raised by Dr. Jander, subsequent studies have confirmed this entity. And in fact, the studies have shown treatment actually improves their prognosis compared to people that are not treated with either surgery or transcatheter aortic valve replacement. Specifically, cohort B had about 50 patients that were in each group of patients that were medically managed and also low flow despite preserved EF and severe aortic stenosis, and they did have a less death rate after a TAVR. So certainly they would be helped by this. So take-home message from my topic is that this entity does happen despite preserved EF. Some people have low stroke volume and yet have severe aortic stenosis. You can confirm the severity by either CAT scan or other measures to make sure there is no errors in LVOT measurement. And if people found to have this, they would benefit from treatment such as surgical aortic valve replacement or transcatheter if they have symptoms as recently outlined by the 2014 guidelines that just came out earlier this year. Thank you very much. I feel this is very important because patients are getting older, and frequently this is a population that are affected by aortic stenosis. So one needs to be aware of this condition and not unnecessarily send patients with misdiagnosis, but properly diagnose this condition and treat them appropriately.
Thank you very much.
Okay.
Have yourself a good morning.